Why do we check fluid levels in pregnancy? So we can check the fluid in two different ways, an AFI, which is an amniotic fluid index, or a DVP, which is preferred, which is the deepest vertical pocket. And we want the DVP to be 2 minimum or 8 maximum. Now the fluid levels are a surrogate for how baby is doing for a couple reasons. So we know the fluid is fetal urine, right? So baby pees and then swallows. So it tells us that, first of all, baby can swallow and there's no blockage in the GI tract, that the bladder system is working, and there's normal flow there. It also can tell us about your hydration status, because sometimes if you're dehydrated, the fluid is low. It can give a reason for why baby isn't moving normally in the third trimester. Sometimes if the fluid is low, baby doesn't have a lot of room to move around, and that can cause decreased fetal movement. If you are having monitoring for some high-risk issue in pregnancy, the fluid level is going to be part of the testing. So your biophysical profile, the fluid level is a part of that, or a modified biophysical profile. You can use the fluid levels to detect if they have ruptured membranes. Now, it's not my favorite way, because you can have ruptured your membranes and still have normal fluid levels, but it is helpful if the fluid is very, very low, right? If there's no fluid around the baby, then that's going to trigger us to check to make sure your water hasn't broken, if it's not an obvious thing where there's fluid all over the place. So let me know if you have any questions about fluid levels, and of course, like and follow for more.